In this video, we will learn about all the medical facts about tuberculosis, commonly known as TB. It is considered the most common cause of infectious disease-related mortality worldwide. What is tuberculosis? Tuberculosis is a contagious, multi-systemic disease with myriad presentations and manifestations. Bacteria called Mycobacterium tuberculosis, which usually attacks the lungs causing pulmonary tuberculosis, cause it. This bacterium can potentially cause extrapulmonary tuberculosis by spreading to other areas of the body. It has the potential to spread to the lymph nodes, brain, spine, genitourinary system, and gastrointestinal tract. How is tuberculosis transmitted? Tuberculosis is a contagious disease transmitted from person to person through inhalation of droplets released into the air from untreated patient with active pulmonary tuberculosis. This occurs when this patient coughs, sneezes, speaks, or laughs. Thankfully, tuberculosis is a difficult infection. In another meaning, it is not easy to catch tuberculosis infection. The majority of individuals with active tuberculosis who have received effective therapy for at least 2 weeks are no longer contagious. What are the types of tuberculosis? TB can be active or latent. In the former case, the bacterium multiplies, making you ill and contagious, while in latent TB, your immune system keeps the bacterium from spreading, and so you do not have any symptoms, and you are not contagious, but infection is still alive and can be one day become active. An immune system that is functioning properly frequently defeats TB bacteria, yet, a number of illnesses and drugs can impair your immune system and raise your chance of contracting tuberculosis. Debilitating illnesses like AIDS, diabetes mellitus, cancer, and the usage of chemotherapeutic drugs and drugs for organ transplantation are among these situations. The aging process, poor nutrition, underweight, and smoking are additional risk factors. What are the signs and symptoms of tuberculosis? There are 2 groups of signs and symptoms for active pulmonary TB: general symptoms and pulmonary symptoms. Fever, nocturnal sweats, exhaustion, loss of appetite, and unintended weight loss are some common symptoms. Pulmonary symptoms include coughing for more than 3 weeks, hemoptysis, that means coughing up blood, and chest pain with breathing or coughing. If tuberculosis spreads outside the lungs, other signs and symptoms appear and vary according to the organs involved. How is tuberculosis diagnosed? The Man-2 tuberculin skin test and interferon gamma release assays are 2 frequently used diagnostics for the diagnosis of tuberculosis. These tests cannot determine if you have an active or latent infection. Your doctor will determine which type you have if a skin or blood test results in a positive result by 2 procedures. The first is a plain chest X-ray or CT scan of the lungs. Acid-fast bacillus testing for TB germs in your sputum is the second technique. What are the complications of tuberculosis? Tuberculosis complications include lung damage, joint damage, liver or kidney problems, brain and spinal cord problems. How to prevent the spread of TB disease? If you have a latent infection, take all of your medications so it does not become active and contagious. If you have active TB, limit your contact with other people. You should cover your mouth when you cough or sneeze or laugh. Children in countries where TB is common often get the BCG vaccine. However, it does not always protect against infection. How to treat tuberculosis? You must take a number of anti-tuberculous medications in combination for 6 to 12 months in order to treat TB. The most widely used anti-tuberculous medications include pyrazinamide, isoniazid, rifampin, and ethambutol. If you skip a dosage or stop taking your antibiotics before the course is finished, the illness could become resistant to medication. After going over all the previous information regarding tuberculosis, it is important to note that it continues to kill a significant number of people due to the rise in drug-resistant Mycobacterium tuberculosis strains. In the end, if you liked this video, do not forget to subscribe to the channel and activate the bell button to receive all new updates. Goodbye.